Okay, the next genus we're going to talk about is Klebsiella, also part of the Enterobacteriaceae family. We've mentioned Klebsiella before when we were comparing it a little bit to Streptococcus pneumoniae. Just to go over a couple of features of the species really quick. They're gram-negative rods, and remember, the major virulence factor here is going to be the capsule. Okay? We're going to specifically talk about Klebsiella pneumoniae, and just like the rest of the species of the Enterobacteriaceae, Klebsiella are oxidase negative. Okay? So again, some of the other organisms we talked about that were oxidase positive, you're going to be able to differentiate them based on oxidase. Now, the reservoir for Klebsiella, remember it's gram-negative rod, so it can be normal flora of the colon, but it could also be normal flora of the upper respiratory tract. And similarly to strep pneumo and some of the other organisms we talked about, this can colonize the upper respiratory tract, colonize the colon, doesn't cause disease in everyone that's colonized. Now, transmission is considered predominantly endogenous, okay, because it is part of the normal flora. Pathogenesis, again, you're going to go with the capsule, unless they're talking about shock, and then, of course, you're going to go back to the LPS. Now, pneumonia we talked about with Streptococcus pneumoniae. We said it was a lobar pneumonia. You had the fever, the chills, etc. And that's going to be similar here. But this is the pneumonia that you typically think about in an alcoholic. So in the vignette, they'll usually mention, a lot of the times it's an elderly person, they're an alcoholic, and they develop this lobar pneumonia. And what do they mention about the sputum? They mention the current jelly sputum. And that's the buzzword for Klebsiella pneumoniae. And current jelly sputum speaks to the fact that it's encapsulated, so it's a very thick, gelatinous sputum. And if you know what a currant berry is, it's very dark red, so it's a bloody, thick, gelatinous sputum. Now, it is, again, endogenous, so via inhalation of the organisms from your own respiratory tract, you acquire the infection, and it is very difficult to treat, okay? Now, the last point I want to talk about is the third bullet point that you see there on the slide. The sputum's thick and bloody, but it's not foul smelling, okay? Now, one of the things you're going to have to do on the exam is differentiate between Klebsiella pneumoniae and then aspiration pneumoniae, okay? So in order to differentiate between the two, as you know, they're both very common in alcoholics. How are you going to differentiate between the two? And that third bullet point speaks to that a little bit. Number one, that Klebsiella has this thick gelatinous sputum, but it's not foul smelling. Aspiration pneumonia is foul smelling. Why? Because it's anaerobic. Remember, in anaerobes, one of the things we talked about that was common with anaerobes is that you're going to have this very foul smell associated with it. So somewhere in that vignette for aspiration pneumonia, you're going to read in there that, you know, the physician walked into the room and noticed that the patient's breath, whatever, was very foul smelling. It's very common for aspiration pneumonia. So you'll have to differentiate between those two, okay? Additional diseases caused by Klebsiella are no different from the other Enterobacteriaceae. Can have urinary tract infections as well as gram-negative sepsis. Very similar to the mechanisms that we've talked about for E. coli, for example. Now, diagnosis. Diagnosis is going to be by culture and gram stain. You're going to culture on McConkey. And remember, Klebsiella is also a lactose fermenter. So you're going to get this pink formation of the colonies on McConkey agar. Okay? Now, additionally, if you were to get a vignette on Klebsiella pneumoniae, they may show you an image. They may say, we gram stain the sputum, and it's shown in the image. And you look at the image, and what you're going to see are pink rods surrounded by that white halo, similar to what we showed with Streptococcus pneumoniae, okay, because of the capsule. So that's going to be very telltale for Klebsiella if you're to see that in a gram stain of the sputum from somebody with pneumonia. Okay. Now the treatment, we are going to go with probably a third generation cephalosporin. You can add an aminoglycoside for extra coverage. And prevention, because it's endogenous, is difficult, but as far as urinary tract infections, it goes back to the catheter use. Okay?